This is All India Radio. We now bring you a special news program on COVID-19. Good morning. I am Tanvi Taneja and with me is Subhadra Ramachandran. The headlines. Centre asks all states and union territories to allow transportation of all goods without distinction of essential and non-essential during lockdown. Home Ministry says migrant people must be quarantined for a minimum period of 14 days. Government forms 11 empowered groups to suggest measures for healthcare and minimize hardships to the people during the lockdown. Uttar Pradesh government to transfer 611 crore rupees in the accounts of over 27 lakh Manrega labourers today. And government to use exclusive cargo flights to transport medical equipment and essential items to the northeastern states. The Home Ministry has asked all states and union territories to allow transportation of all goods without the distinction of essential and non-essential during the 21-day lockdown period. In a letter to State Chief Secretaries, Home Secretary Ajay Bhalla said the newspaper delivery supply chain is allowed during the lockdown. He also said the entire supply chain of milk collection and distribution, including its packing materials, has also been allowed during the period. Besides, groceries, including hygiene products such as hand wash, soaps, disinfectants, oral care items, battery cells and chargers are also allowed. Mr. Bhalla said the services of Indian Red Cross Society are included under establishment of National Disaster Management Authority. The Centre has asked state governments and union territory administrations to effectively seal state and district borders to stop movement of migrant workers. It is ordered to ensure adequate arrangement of temporary shelters and provisions of food and other facilities for poor and needy people stranded due to lockdown announced in view of COVID-19 outbreak. Briefing reporters in New Delhi yesterday, Joint Secretary in the Home Ministry, Punya Salila Srivastav said, the migrant people who have moved out to reach their home states must be kept in the nearest shelters by the concerned states and quarantined after proper screening for a minimum period of 14 days.
जो स्ट्रैंडेड लेबर है उसके लिए फूड और शेल्टर का प्रावधान हो। स्टेट डिजास्टर रिस्पॉन्स फंड के अंतर्गत स्टेट्स और यूटीज को इसके लिए सफिशिएंट फंड मिला हुआ है। जो लेबर चल चुकी है उसको उसके गंतव्य स्थान पर स्टैंडर्ड हेल्थ प्रोटोकॉल के अनुसार मिनिमम 14 दिन के लिए क्वारंटाइन किया जाए। जितने एम्प्लॉयर्स हैं उनको निर्देश दिया जाए और ये लागू किया जाए कि क्लोज डाउन पीरियड के लिए वर्कर्स को उनके वर्क प्लेसेस पर ड्यू डेट पर बिना डिडक्शन के पूरी वेजेस दें। जो वर्कर्स रेंटेड अकोमोडेशन में रह रहे हैं उनके लैंडलॉर्ड ना उनसे 1 महीने का रेंट मांगेंगे और ना उनसे खाली कराएंगे।
Our correspondent has filed this report.
Terming the movement of a large number of migrant workers to reach their hometowns as a violation of lockdown, the Home Ministry asserted that District Magistrate, Superintendent of Police and DCP will be personally liable for implementation of direction of the centre and the lockdown measures. The Ministry has also asked states and union territories to allow transportation of all goods without distinction of essential and non-essential during the 21-day lockdown period. It has also been made clear that the newspaper delivery supply chain is allowed during the period. The entire supply chain of milk collection and distribution, including its packing material, has also been permitted. In his letter to states, the Home Secretary also clarified that several hygiene products like soap, shampoo, detergent, tissue paper, toothpaste and oral care items also come into the category of grocery, which is exempted from the lockdown. Divakar, Air News, Delhi.
Union Home Minister Amit Shah has communicated to the state and UT governments to take appropriate steps to ensure effective implementation of the lockdown measures while mitigating the economic hardship of the migrant workers during the nationwide lockdown. He said the Narendra Modi government is dedicated to alleviate sufferings of people during the 21-day lockdown to fight COVID-19. BJP President JP Nadda has instructed the party's state units to help daily wagers and migrant labourers in their states during the lockdown period. Mr. Nadda has been holding daily meetings with BJP leaders through audio and video conferences to oversee the party's efforts to help the poor amid the outbreak of the novel coronavirus. The control room set up at Bihar Bhavan, New Delhi to help the migrant workers from the state received over 2,500 calls yesterday, while action was taken on the grievances of 1.15 lakh people. Action was also taken on all 9,000 applications received on the Google Doc system. Resident Commissioner Vipin Kumar, in coordination with the other state governments, is arranging food, shelter and medical facilities for the workers stranded in different parts of the country. Mr. Kumar said it is the priority of the Bihar government to provide assistance to these workers. The helpline numbers 230-14326, 2379209 and 230-13884 set up at the control room are working round the clock.
Prime Minister Narendra Modi has urged people to maintain social distance and not emotional and human distance while battling COVID-19. Sharing his thoughts in the Man Ki Baat program on All India Radio yesterday, the Prime Minister said that social distancing is the most effective way of fighting against COVID-19, and by complying with the lockdown, people are protecting themselves. The Prime Minister said, however, people need to understand that social distancing does not mean ending social interaction.
कोरोना वायरस से लड़ने का सबसे कारगर तरीका सोशल डिस्टेंसिंग है, लेकिन हमें ये समझना होगा कि सोशल डिस्टेंसिंग का मतलब सोशल इंटरेक्शन को खत्म करना नहीं है। वास्तव में यह समय अपने सभी पुराने सामाजिक रिश्तों में नई जान फूंकने का है, उन रिश्तों को तरोताजा करने का है। एक प्रकार से ये समय हमें यह भी बताता है कि सोशल डिस्टेंसिंग बढ़ाओ और इमोशनल डिस्टेंस घटाओ। मैं फिर कहता हूं, सोशल डिस्टेंसिंग बढ़ाओ और इमोशनल डिस्टेंस घटाओ।
Mr. Narendra Modi said the steps being taken by people to stop the spread of corona and the efforts being made will ensure that India conquers the pandemic.
आज हर भारतीय अपने जीवन की रक्षा के लिए घर में बंद है, लेकिन आने वाले समय में यही हिंदुस्तानी अपने देश के विकास के लिए सारी दीवारों को तोड़कर आगे निकलेगा, देश को आगे ले जाएगा। आप अपने परिवार के साथ घर पर रहिए, सुरक्षित और सावधान रहिए। हमें ये जंग जीतना है, जरूर जीतेंगे।
Government has constituted 11 different empowered groups to suggest measures to ramp up healthcare, put the economy back on track and reduce the misery of people as quickly as possible post 21-day lockdown. Each group has a senior representative from PMO and the Cabinet Secretariat to ensure seamless coordination. These groups have been set up under the Disaster Management Act. The groups have been empowered to formulate plans and to take all necessary steps for their time-bound implementation. The total number of confirmed COVID-19 cases in the country has gone up to 1,024. Out of the total cases, 95 patients have been cured and discharged from the hospitals, while 27 died. Briefing reporters in New Delhi, Joint Secretary in the Health Ministry, Love Agarwal said the ongoing 21-day lockdown has resulted in some behavioral mental health issues, and the National Institute of Mental Health and Neurosciences has launched a toll-free number 080-4611-0007 for consultation. On a query for specific blocks and hospitals for COVID-19 patients, he said the process to isolate them from other patients has started. Raman Gangakhetkar, head scientist in Indian Council for Medical Research, said around 35,000 tests have been conducted till date. He said 113 labs are functional and 47 private labs have been given approval. In the wake of growing novel coronavirus cases in the country, the Health and Family Welfare Ministry has issued several advisories for the people to contain the spread of COVID-19. These advisories stress on several preventive measures like social distancing, personal hygiene, and restriction of mass gatherings. Here is a report.
Government has advised people to follow basic protective measures to keep themselves safe from the coronavirus. People should strictly follow the social distancing norms and avoid gathering. They should stay at their homes and go out for buying essential items only when it is absolutely required. People are advised not to touch their eyes, nose and mouth. Frequent hand sanitization is a must. They should keep cleaning their hands with soap and alcohol-based hand sanitizers. Both sides of hand has to be washed for at least 20 seconds. If a person is experiencing cough and fever or any other symptom, he or she should avoid close contact with others and doctors should be consulted immediately. The Health Ministry has issued a toll-free number 1075 for the public inquiry about coronavirus. Bhupendra Singh, AIR News, Delhi.
Experts have also pointed out that lockdown and social distancing can be among the most effective measure to counter the menace of novel coronavirus. Talking exclusively to All India Radio News, Dr. Sanjay Pandey of GB Pant Hospital, Delhi, has emphasized on social distancing.
कोरोना वायरस का संक्रमण रोकना जरूरी है और आज के दिन कोरोना वायरस का कोई इलाज नहीं है और इलाज के अभाव में अगर हम इसका संक्रमण नहीं रोकते हैं तो यह घातक हो जाएगा। घरों में रहने से क्या है कि इसका जो संक्रमण करने की जो प्रक्रिया है, चूंकि हम लोगों से कट जाते हैं और एक व्यक्ति से दूसरे व्यक्ति में इसका प्रसार नहीं होता है, तो इसलिए सेल्फ आइसोलेशन या सोशल डिस्टेंसिंग जो भी नाम ले लीजिए, यही एकमात्र विकल्प है।
Dr. Pandey also elaborated on the symptoms of the disease.
इसके लक्षण जो फ्लू है या सर्दी जुकाम है उससे मिलते जुलते होते हैं। 80 से 85% जो मरीज होते हैं उनमें लक्षण बिल्कुल सामान्य होता है और वो रिकवर हो जाते हैं। 10% ऐसे पेशेंट होते हैं जिनको थोड़ी सांस की दिक्कत होती है, बट ऑक्सीजन और मामूली से सपोर्ट से उसमें काफी पेशेंट बाहर आ जाते हैं। 5 से 10% पेशेंट ऐसे हो सकते हैं जिनमें सांस की दिक्कत ज्यादा हो सकती है और यह तकलीफ आमतौर पर उन मरीजों को होती है जिनको पहले से कुछ हाइपरटेंशन है, डायबिटीज है, सांस की दिक्कत है या उनकी एज ज्यादा है। तो अगर कोई रिस्क फैक्टर आपके साथ है तो उस कंडीशन में आपको ज्यादा सावधानी बरतनी है।
The importance of lockdown and why it is necessary can be gauged from the fact that it took almost 18 weeks for the number of COVID-19 cases across the globe to rise from 0 to 3 lakh. However, after this period, it just took a week for the number of cases to go up from 3 lakh to 6 lakh cases. Countries like Italy, the US and the UK, among others, faced the heat and the number of cases kept on rising during this time. What it shows is that the need of the hour is to stay at home. This measure adds to the practice of social distancing. Hence, by complying with the lockdown norms, we can break the chain of transmission of coronavirus. Experts have pointed out that lockdown and social distancing can be among the most effective measure to counter the menace of novel coronavirus. So stay home, stay safe. This is All India Radio giving you a special program on COVID-19. Let's take a look at the headlines once again. Centre asked all states and union territories to allow transportation of all goods without distinction of essential and non-essential during lockdown. Home Ministry says migrant people must be quarantined for a minimum period of 14 days. Government forms 11 empowered groups to suggest measures to strengthen healthcare and minimize hardships to the people during lockdown. Uttar Pradesh government to transfer 611 crore rupees in accounts of 27.15 lakh Manrega labourers today. Government to use exclusive cargo flights to transport medical equipment and essential items to northeastern states. For quick news updates, round the clock, follow us on our Twitter handle at AIR News Alerts.
In Nagaland, a total of 3,982 people, including students who have returned from outside the state from 6th of March, have reported to their respective district surveillance teams and are presently under home quarantine. Briefing on the current state status of COVID-19 at Kohima, Home Commissioner Nagaland, Abhijit Sinha said, out of 22 samples that have been sent for testing, 17 were found negative and the remaining 5 results are awaited. He also informed that a state-level control room during COVID-19 has also been set up to address the grievances of citizens. The numbers are 0370 229 1122 and 0370 22911120. In West Bengal, another 3 persons have been tested positive for coronavirus yesterday, according to State Health Department sources. With these, total number of positive cases have gone up to 20, of which 1 person has died so far. In Gujarat, the total confirmed cases of COVID-19 have reached 63, with 5 new cases reported. Our correspondent has filed this report.
Lockdown is being strictly implemented in Gujarat. State DGP Sivanand Jha said that police has been asked to take strict action against the violators of lockdown. Rapid Action Force and Crime Branch Jawans will be deployed in difficult areas. Meanwhile, Principal Secretary of State Health Department, Dr. Jayanti Ravi, appealed the people to make self-declaration about their foreign travel to check the spread of coronavirus. She said that the work of 50-bed private and 50-bed government hospitals with ventilator facilities in each district of the state is in final stage. Meanwhile, state government has announced the special relaxation for the farmers in view of ongoing rabi crop season. Now farmers can go to their farms and warehouses for harvesting crops along with laborers, drivers and owners of harvesting machinery. Horticulture and vegetable producers will also get similar relaxations. Yogesh Pandya, Air News, Ahmedabad.
The Gujarat State Education Department has decided to introduce home learning process for students following the lockdown. Every Saturday, students will be provided study material via social media platforms for the next 4 to 5 weeks. Ladakh has not witnessed any new coronavirus case for the last 10 days. Secretary Commissioner Ringzin Samphail said for effective management of the pandemic, the UT administration will shortly begin exclusive COVID-19 hospitals, each one in Leh and Kargil districts. The Tamil Nadu government announced the program on Saturday to screen the public in most vulnerable areas of the state. The places identified for the screening were those falling under 5-kilometer radius from the houses of those confirmed to be positive for the infection. Our correspondent has more.
The authorities in Tamil Nadu are taking measures to contain the spread of the SARS-CoV-2 or the novel coronavirus that causes the COVID-19 disease so that its spread does not progress to phase 3. They are also taking the necessary steps to make available all essential commodities without any hardships for the public. They include the ease of restrictions in vehicular movement and exempting farm activities from the Section 144 clampdown. So far, only the general personal assistants of district collectors were allowed to issue the authority letters to the people and vehicles involved in transporting essential commodities from one place to the other, including to other states. Jai Singh, AR News, Chennai.
Telangana Chief Minister K. Chandrasekhar Rao has said the state may come out of the COVID-19 pandemic by the end of the first week of April. He said 11 coronavirus positive patients have tested negative after treatment at designated hospitals. He urged the migrant workers to stay where they are and assured that the government will extend all necessary help required to them during the lockdown period. The Madhya Pradesh government has made concrete arrangements for protection and treatment from coronavirus. Around 1,500 beds are ready at Bhopal and Indore for treatment of corona-affected patients. So far, 39 coronavirus patients have been detected in Madhya Pradesh. 2 of them have succumbed to the disease. A report.
For the convenience of public, the date of depositing property tax, professional tax, Kisan credit card payment as well as school and college fees has been extended till April 30 in Madhya Pradesh. Chief Minister Shivraj Singh Chauhan informed during a Facebook Live yesterday that the board examination of class 10th and 12th has already been postponed and general promotion will be given in other classes. On the other hand, a Sipahi from Rajgarh district walked approximately 450 km from Etawah to Rajgarh by foot to take up his duty on time. Sipahi Digvijay Sharma was honored by the SP of district on his dedication toward responsibility. Sanjeev Sharma, AIR News, Bhopal.
Kerala continues to be on high alert as more COVID-19 positive cases have come up in the state. Our correspondent has more details.
20 more COVID-19 positive cases are confirmed in Kerala, taking the total number of infected patients in the state to 181. Among the newly confirmed cases, 18 people had returned from Gulf region and one is a health worker. Kasaragod is the worst hit district where alone the total number of COVID-19 patients is over 80. State Health Minister K.K. Shailaja said that the rapid test will be started soon to find out the possibility of community spread in the state. Meanwhile, government is planning to deliver essential services online in the state. Travel passes can also be applied online. More than 140,000 people are under observation in the state. People at large are completely cooperating with the lockdown in the state. Mayusha for AR News from Thiruvananthapuram.
In Karnataka, COVID-19 positive cases have gone up to 83, which includes 3 deaths and 5 discharges. The government has requested the public to call helpline 104 Arogya Sahay Vani for any COVID-19 related queries. More from our correspondent.
Bengaluru Mahanagara Palike supplied 1,75,700 food packets yesterday through 31 Indira canteens. Totally 2,23,999 food packets were distributed to the poor in Bengaluru with the help of social service organizations and individuals. 2 private hotels in Bengaluru have come forward to supply food packets to COVID-19 frontline warriors. Dakshin Kannada in-charge Minister Kota Srinivas Pujari has informed that 2-month ration will be given free of cost to the card holders under PDS system from 2nd of next month. In another decision taken yesterday by the government, mosques have been asked to create awareness about preventive measures on coronavirus through their loudspeakers. Sudhindra, AIR News, Bengaluru.
With as many as 22 persons testing positive for coronavirus in Maharashtra yesterday, the number of COVID-19 patients in the state climbed to 203. State Health Minister Rajesh Tope informed as many as 35 COVID-19 patients were discharged after recovery. He said the discharged patients will have to observe a mandatory 14-day home quarantine.
Uttar Pradesh Chief Minister Yogi Adityanath will transfer 611 crore rupees in the accounts of 27.15 lakh Manrega labourers today. The amount will be transferred electronically to help the labourers in the situation of lockdown due to coronavirus. State government has said that there are no signs of community spread of the virus in the state. More from our correspondent.
Chief Minister Yogi Adityanath has directed private enterprises and organizations to must give 1 month's salary to their employees without any deduction. This should be done by opening the offices today and tomorrow, and the salary should be sent to the accounts of the employees. Additional Chief Secretary Home Avnish Awasthi said that no landlord would charge 1 month's rent from any worker or labourer. On receiving any such complaint, the police will take strict action against the landlord who took the rent. The state government reiterated that nodal officers in 16 states of the country are helping the people of Uttar Pradesh in their respective areas and appealed everyone to remain wherever they are and follow the lockdown. Meanwhile, Gautam Buddha Nagar administration took over the JP Sports City to convert it into the shelter home for the labourers. Sushil Chandra Tiwari, AIR News, Lucknow.
The cargo air flights will be used exclusively for transporting medical equipment and emergency goods, besides other essential items, to the northeastern states in the wake of lockdown. This was disclosed by Union Minister for Development of Northeastern Region, Dr. Jitendra Singh. He said this will go a long way in reassuring the people of the region that even at this hour of trial, they are receiving as much attention as any other part of the country.
Government has initiated disciplinary proceedings against 4 Delhi government officers for dereliction of duty regarding containment of spread of COVID-19. Home Ministry said these officers have failed to ensure public health and safety during the lockdown restriction. The ministry said it has been brought to the notice that these officers, who were responsible to ensure strict compliance to the instructions issued by Chairperson National Executive Committee formed under Disaster Management Act regarding containment of spread of COVID-19, have prima facie failed to do so. The ministry has suspended Additional Chief Secretary, Transport Department, Delhi Government and Principal Secretary, Finance, Delhi Government with immediate effect, while show cause notice have been issued to Additional Chief Secretary, Home and SDM Selampur of Delhi. Indian Railways has decided to provide bulk cooked food with paper plates to needy people from the locations where they have base kitchens of Indian Railway Catering and Tourism Corporation IRCTC. Ministry of Railways said that IRCTC yesterday supplied a total of 11,030 lunch meal to needy people, migrant labourers, few old age homes and others at locations including Delhi, Patna and Ranchi. IRCTC will produce and provide food on demand. Indian Railways and IRCTC are gearing up to meet any higher demand to provide food to needy in the times of COVID-19 lockdown. National Book Trust NBT will launch Corona Study Series books to provide relevant reading materials for all age groups for the post-corona readership needs. Human Resource Development Ministry said, realizing the extraordinary psychological, social, economic and cultural significance of corona pandemic for the human society in times to come, NBT will launch this series. In the fight against COVID-19, one must take note of the number of those who have recovered. It reflects that despite odds, the battle against coronavirus pandemic is on. The number of recovered coronavirus patients in China has reached 75,000. In India, 95 patients have been cured so far. Israel has reported that 89 cases have recovered, while in Portugal, 43 patients have been cured of COVID-19.
Canadian Prime Minister Justin Trudeau has informed that he would remain in self-imposed isolation even though his wife, who had contracted the coronavirus, has recovered. As of Sunday, 6,243 Canadians had tested positive for the coronavirus and 64 have died. In Singapore, 42 new coronavirus cases have been reported, taking the total number of infections in the country to 844. 3 Indians are also among the new positive cases. In Haryana, women police of Jind have taken a good initiative. They are visiting slum areas of the city to help the poor when slum dwellers are unable to earn their livelihood. A number of police women, including Sheila, Anita and Monica, told AIR that they are distributing food packets and masks to the poor by personally visiting these people and also educating them about the precautions required to be taken to stop the spread of COVID-19. While ensuring adequate supplies of petrol, diesel and LPG for people during the lockdown period, the oil marketing companies are also distributing foods to migrant workers and needy people at their retail outlets and other places to help them in this difficult hour. Not only this, they're also organizing langars for truck drivers to ensure hassle-free movement of essential goods in different parts of the country. The oil marketing companies are also helping the poor and laborers with essential goods in Delhi and NCR region. World Athletics President Sebastian Coe said that the decision to postpone this year's Tokyo Olympics because of the coronavirus has saved athletes from mental turmoil. Former Olympic champion Coe supported the move to push the games back to 2021. He said competitors would have been placed in an impossible position if the event had been left to start on July 24th as originally scheduled.
And now an overview of today's newspapers covering COVID-19 stories. The continuing mass movement of migrant workers on roads and highways amid the countrywide coronavirus lockdown gets top attention in newspapers today. Government orders sealing of state, district borders to check mass infection, reports the Statesman. The Times of India writes, seal borders to stem migrant exodus, ensure shelter, food, wages, rent relief, government to states. The Hindu says, migrant workers to be stopped, quarantined at borders, orders centre. Informal sector workers not registered, officials flag problems in paying wages, headlines are Indian Express. No more essential and non-essential. Curbs on goods transport lifted, informs the Indian Express. Newspaper supply chains and list of essential services, writes the Hindustan Times. Quoting a Chinese research underlining the importance of random testing at a mass scale to identify the silent carriers of COVID-19, the Pioneer writes, mass tests in India must, as 50% China cases showed no symptom. Spain princess, first royal to die from COVID-19, notes the Times of India. German minister kills self on virus crisis worries, headlines a Pioneer. Under the caption Lockdown Tips, the Hindustan Times shares the story of Navy Commander Abhilash Tomi, who spent an astonishing 275 days in complete isolation trapped at sea. And finally, there is a silver lining in the countrywide coronavirus lockdown, and that is clean air. Quoting from the Central Pollution Control Board data, the Pioneer writes, as many as 103 cities in India registered vastly improved air quality on Sunday, with people seeing blue skies instead of heavy grey smog. With that, it's back to you, Tanvi.
Thank you, Subhadra. And now, before we end the special news program on COVID-19, here are the headlines once again. Centre asks all states and union territories to allow transportation of all goods without distinction of essential and non-essential during lockdown. Home Ministry says migrant people must be quarantined for a minimum period of 14 days. Government forms 11 empowered groups to suggest measures to strengthen healthcare and minimize hardships to the people during lockdown. Uttar Pradesh government to transfer 611 crore rupees in the accounts of over 27 lakh Manrega labourers today, and government to use exclusive cargo flights to transport medical equipment and essential items to the northeastern states. And with that, we end the special news program on COVID-19.